is Patricia S. Gray, the president of the Liberia Medical Student Association, AM School of Medicine. We will now ask that we all stand for a moment of silent prayer. Amen. You may now have your seat. I'm happy that we are already done with the breakfast, so don't get carried away. When we call on people for 5 minutes talk, we shouldn't complain because we are energized enough. So we will have our welcome remarks that will be done by the Dean of the AM School of Medicine, and Chelsea Plyer, the Project Director of Bridgeview Liberia. Ladies and gentlemen, please put your hands together for them as they come forward.
Morning. The President of the University of Liberia, Honorable Dr. Reverend J. Saulo Nelson, Vice Presidents of the University of Liberia here present, Deans and Directors of Academic Programs here present, Ministers of Government and Directors of Agencies also present, the Deputy Head of Mission, the U.S. Embassy in Monrovia, present here, Country Director of USAID and CDC in our midst today, academic partners from Yale University, from Vanderbilt, from Boston U, and our sisters university in Monrovia, faculty and staff of the College of Health Sciences, students, our visitors that are watching remotely in other countries around the world, ladies and gentlemen. It is my privilege and pleasure to invite you to this program today of the University of Liberia College of Health Sciences Teaching, Learning, and Innovation Center, which is part of the USAID-funded Bridgeview project, which is applying research for a healthy Liberia project. And many of you have braved this really bad weather today to show up here. Is a testament that this is a great program indeed. Besides this launch of this center, we will also be having an innovation and entrepreneurship seminar so that we begin a new trend at this college in making our products of this university more innovative and with the entrepreneurial spirit. Besides that, we'll be taking you out to see our new ELAB and Simulation Center at the John F. Kennedy Medical Center. By these undertakings, we envision that our faculty and students, regardless of their race, their creed, or their circumstances, will achieve their full potential given these developments. I want you to remember here today that success is not about perfection, it's about progress. And the progress we have made here over the last year is a testament to where we are going. Again, we welcome you to this occasion and all our activities, and we hope you have a pleasant stay. Thank you.
Thank you, Dean Sherman. Good morning, everyone. Since Dean Sherman welcomed you all on behalf of the college, I now have the privilege of welcoming you on behalf of the project that brought us here today. That's Bridgeview, Applying Research for a Healthy Liberia. It's a little bit redundant, I think, because Bridgeview as a project only exists in and through the college itself. But hopefully you'll indulge me just for a moment. The program today is built around the three themes of the center. That's teaching, learning, and innovation. So you'll see us coming back to those themes over and over again throughout the program. We have 3 spotlight presentations, each of which will look at one of those themes from a particular angle or case study. We have a panel of dignitaries who will talk about challenges and opportunities for research utilization in different parts of the Liberian health sector. We'll hear some poetry on those themes: teaching, learning, innovation. And throughout the program, we'll show you a set of 6 videos, each one of which introduces one of the programs that makes up CTLI. So thank you for being here today. We hope you enjoy the program. We hope you learn a little something. We hope you're inspired. And we hope this is just the beginning of long, rich engagement for each and every one of you with this new entity. Thank you.
We say thanks to the Dean and to the project director. So success is by the innovation you bring on, or education as in the innovation that is done. And it's no one that is doing that for the College of Health Sciences. It is the USAID-sponsored project, Bridgeview Ctli. Now we have the introduction to the University of Liberia College of Health Sciences and the Ctlr, and that will be done by Dr. Brenny Dan, Vice President for the Health Sciences, University of Liberia. Please put your hands together as you come forth.
Good morning, everyone. Okay. I will stand on existing protocol and I will carry you through how the college has evolved over time, where we are today, and where we hope to go. So the college, or this campus, started with the A.M. Dougherty College of Medicine, with the teaching center, GFK Medical Center. And the history is that in the early years, 1956, our president, Topman, met with the Pope Pius XII, and asked him to assist him to build a modern hospital and a medical school. 11 years after, the Monrovia Torino College of Medicine, which is now the A.M. Dougherty College, was established. It took in its first students. They were 14 preclinical students in 1968. And then in 1971, the U.S. helped the country and build the GFK Medical Center that opened in 71 and served as the teaching hospital for the A.M. Dougherty College of Medicine. And then the TNIMA, which is the Topman National Institute for Medical Arts, also relocated into that facility, and clinical rotation began. So in 1973, the school graduated the first set of doctors. They were 4. Out of the 4, there was 1 female who was an Indian, and there was only 1 Liberian. And that was Dr. Bowman. Most of the women in this country can remember Dr. Bowman. He died sometime last year. And then in 1975, the class had 2 females in that class, in that graduating class. Between the first 8 years, the school graduated about 61 doctors. The clinical training at GFK started with the 4 core disciplines: internal medicine, pediatrics, obstetric and gynecology, and general surgery. And then following graduation, the doctors did their internship at the GFK Medical Center and in rural hospitals. And then in 1986, the School of Pharmacy was also founded and coexisted with the A.M. Dougherty College on this campus. I just want us to look at the statistics a little bit on my far right. So in 1969, there were about 110 physicians in Liberia. 54 of them worked in government hospitals, and less than 30 of them were Liberians. There were about 341 nurses and midwives. In 1976, there were 51 physicians at GFK alone. I guess the teaching also brought in a lot of physicians to help to teach. And I think my boss man is also looking at that figure because I know how I have to justify why one person cannot teach one course at a medical school. And out of the 51, there were 21 Liberians. By 1980, with the production of the doctors from the school, there were about 100 Liberian physicians nationally. And the biggest class there between the time the school opened up to about 2006, 2007 had 28 students. And in 1980 had the biggest class. 10 of them were females and 9 graduated. And Dr. Macaulay, who is is a graduate of that class. Then 1988, we had 200, the school is growing, 237 physicians, 656 nurses and midwives. By 2005, we had the civil crisis 1989 up to 2003. And that impacted, go back to that slide. Back, yes. Impacted the education and the healthcare delivery system. So from 1990 to 2003, things started going backwards. GFK was completely shut down for the first time in 1990. About 90% of the healthcare workers fled the country. Health education was seriously compromised. Over-teaching environment, lack of instructors and professors, periodic closure of the university, destruction of infrastructure. By this time we were there, we were halfway through. It took 10 years for me to graduate from these walls for a 5-year program, even though I did not repeat any class. And that was because of that. And then when we completed, there were people behind us and there were no instructors. And so students came to us and asked us to help to teach. So we started teaching. We didn't even know we could teach, but we started teaching. So they too could graduate. The alumni from the school, the A.M. Dougherty, was determined for the school not to close down, knowing that those of us who left remain in the country during the war, knowing that closing the school down will be very difficult to reopen. So we kept the school alive. And so between 1999 to 2000, the university graduated 17 doctors. At that time, those who were in school so were also discouraged doing one semester in 1 year, and things like that. So the numbers reduced significantly. Next slide. So then I found myself at the Ministry of Health. We had to build the health sector. And so rebuilding the health sector, our biggest challenge at the time was the health workforce. In 2005, we had 50 doctors in Liberia. And during the war years, the NGOs recruited, there were a lot of volunteers, just community members volunteering in the health facilities. So they were trained to do basic first aids, and they were the ones in the public health facilities. So it was challenging to actually start the healthcare delivery system. And so we developed a 5-year plan for the Ministry of Health for Emergency Human Resource Plan. And that plan heavily focused on and invested on nursing and midwifery production, because our focus was on the primary healthcare level to address some of the issues there. And we underestimated the physician training needs. And so by 2013, it became glaring that we had to train the doctors, especially the specialists. And so the government, working along, established the Liberian College of Physicians and Surgeons that introduced the postgraduate training program, so a residency training program in internal medicine, pediatrics, OBGYN, and surgery. The first class took in 13 residents across the 4 specialty, and 69% of them were AM Douglas graduates. So by 2012, we had 215 physicians from the 50, and we had 144 of them were Liberians. Next slide. Then while we were making steady progress, Ebola came. 375 health workers got infected, 189 died. About 8% of our professionals lost their lives to Ebola. And that included some of our faculty members. Those of us who walked through this world can remember Dr. Brisbane, who was the CMO at GFK and the chief of emergency room. Dr. Abraham Bobo, he was an internist and he was the deputy CMO at GFK. Dr. John Dada, who was an OBGYN, and all of them were faculty members for the college. So you can imagine the impact that had for a college that did not have instructors already. So by 2016, there were about 234 physicians and 4,004 nurses and midwives. Next slide. So you could see that with the history, the initial investment was yielding results until we started having crisis, and then that challenged the education and the healthcare sector. Next slide. And so in 2014, we decided to do an assessment of the training institutions to determine whether we are training enough health workers to meet the WHO health indicators, and then to be able to meet universal health coverage. And we realized that only sizable and sustained investment will put Liberia on track to meeting the national health workforce targets. If you look at the graph on my right-hand side, the blue was the level at which we were training. And by 2030, we're supposed to be meeting the universal health coverage targets. And so the broken line on top, which is running parallel to the blue line, is what our targets were supposed to be. So we're never going to meet them if we don't scale up. Next slide. And so we developed a health workforce strategy based on the information from that assessment. So the assessment recommended that we improve the quality of education, increase the skill diversity, and scale up production for physicians and midwives, because those two were in acute shortages. The other recommendation was to improve the quality of education and increase skill diversity for the nursing training program. And then to introduce 2 new cadres, the community health assistants, recognize them formally in the country, and then introduce health managers training. At that time, we were taking, once you graduate from AM Douglas College of Medicine, we send you to the county as a county health officer, no experience in how to manage a healthcare delivery system, and people were learning by doing. The study also recommended that we improve the clinical training environment, and so some of those ones started also. Next slide. So the implementation of the health workforce program was driven heavily by the Ministry of Health. Donors supported components of it. The support was not without challenges. I remember USAID supporting the mid-level cadre of health workers by providing all their training needs. The Global Fund supported some of the faculty for them. The World Bank decided to support the faculty for the medical school. The planning cycle for the bank just would not coincide with the academic schedule of the University of Liberia. And so there were many times, and then we were signing annual contracts, which was also not advisable for the program. So get a qualified physician who is a professor to come and teach. He will have to leave his home and come, and he's expecting multiple years contract. You are giving him 1 year contract. He's not sure of the job. So that's one thing that really challenged the medical school. So we were always behind the university schedule. So GFK and the College of Health Sciences became critical impact partners for strengthening the training programs in the country. So the momentum to strengthen the medical school and the School of Pharmacy started building up. At this time, I had left the Ministry of Health. I did not know I was coming I was teaching, but did not know I was coming to head the College of Health Sciences. I was recruited to come and help to continue to build the health workforce. So God just prepared me for the day. Please go back. So since we started 2019, we have built partnerships with academic institutions, a number of them, both from the Western world and from the continent. We continue to have visiting faculty to come and teach both the School of Pharmacy and the medical school. We drafted a strategic plan for the College of Health Sciences, and out of that, we did a 5-year plan for the AMWT College. And so you see all our partners plus ourselves on that side, that picture. That was the development of the AMWT strategic plan. And we started reforming the medical school. So we have actually reformed the curriculum to a 7-year post-secondary degree. And the curriculum is student-centered. It has moved away from faculty-centered to student-centered training. We've also started developing our faculty, the local faculty. We've done some pedagogy trainings for the faculty members those who were recruited during the war and said, just please come and help and teach. Plus those who joined us to start teaching along the way. We've done some mentorship trainings for them. And just last week, we completed training also for residents as teachers and learners. We've converted the Bachelor of Pharmacy to a Doctorate of Pharmacy, and the faculty were also converted in terms of training also. We also designing new programs as they are needed by the country. And one of the programs that after Ebola we asked the university to establish was the Masters in Public Health. So I came just in time to help to establish the program. So we designed and launched the MPH program. We graduated the first cohort early this year. They were 9. We have a very good MPH program that is competitive with any place in the world. We also created a health systems management certificate program for in-service training, knowing that when you graduate today as a physician, they deploy you to go and manage the county health team. When you graduate as a nurse or a midwife, you go as an officer in charge at some clinic or health center. So far we have graduated 62 students. This training is hands-on. It has built-in quality improvement at the job sites. So we have had 4 cohorts. The university, normally the nursing and midwifery training program in this country is the basic training 3 years. And so the university did a bridging program, which is a post-basic training for nurses and midwives that ran for about 5 years. We decided to transition that to a direct entry 4 degrees, 4 years program, direct from high school as the short term, and the long term to introduce master level specialization pathways, as was recommended by the assessment. So the College of Health Sciences is beginning to take shape. So we have furthered the nursing and midwifery bridging program, integrated that, which is the post-basic, into a full degree program that should commence the 27th of, that should commence shortly. The medical school is being strengthened, and we hope that in the future we can introduce a school of dentistry, and it becomes a medicine and dentistry school. The School of Pharmacy has been strengthened. The School of Public Health is a strong one, and we pray and hope we can continue to keep it strong. And then we'll introduce some of the allied health sciences. The biggest gap we had between the university and the teaching hospital was coordination, and so we established an academic office at the GFK Medical Center that is coordinating between the students and the hospital. To be able to reform this College of Health Sciences, it requires investment. We were blessed to have a transformational investment through what we call Bridgeview Liberia. It is a USAID initiative with the goal of promoting research utilization across the health sector. We bid for this grant, 15 million, along with some of our traditional partners, Yale University, who have been here with us, and Vanderbilt University, from Ministry of Health GS to present, working, doing assessment on the medical school and deciding how we can strengthen the medical school. We've also made some new friends. So CIMIT and ELAB, we want to introduce some innovation into the medical sector and especially the private sector, so that some of the results from the research can actually be translated into the private sector that can help to generate resources to support our economy. Since I was a child, and I believe strongly my mother was taught how to be the Benin seed, be the bony dust, mix it with the dry planting dust, and feed us. And most mothers can't afford that. So mothers buy the imported milk from the supermarket that is very expensive, dilute and over dilute. And so then our children become malnourished at a very early age. And when they go to school, preschool, and they are not doing well, then we start beating them, they are dull, forgetting to know that we destroy the brain before they even started. At the moment, one of our faculty members is doing a study on that. And hopefully in the future, this project will scale up that, open the market for the agricultural sector, and the mothers have access to a locally produced food easily that they can feed their babies with. We need to move away from some of those things that we can't afford. We also continue with our traditional government partners, the Liberian College of Physicians and Surgeons, the Ministry of Health, and the National Public Health Institute. So the college is growing steadily, and we are building the support systems across the different schools for the college to be strong. So we've worked along with our partners to establish the Office of Sponsored Research Services. So faculty members and students are being supported with research activities through this office and grant writing, post-award, pre-award. The university also allows us as a test case to open an Office of Fiduciary Services here at the College of Health Sciences. And so we are also managing donor funds here. And hopefully by the end of this year, we'll have our first audit report. Next slide. Now, the big reason why we are here is the Center for Teaching, Learning, and Innovation, the launch of it. Next slide. So what is the Ctli, for short we call it? It's a national public-private academic hub for training and collaboration through Liberia's health sector, supported by institutionalized revenue generation activities and administrative system. And I want to emphasize the revenue generation activities and the administrative systems. I did not know that the education sector has systems until I got here. And we have to build education systems for the health education. Thank you. Next slide. So in this program, we have at the Ctli, we have 6 programs that are ongoing, supported by the Bridgeview. The faculty development program, you'll hear more about it as we go on. We have the xSEL program that is building a pipeline for high school students into the college. The sciences have been our weakest point in the country. During the war years, there were no science teachers in the country. At some point, the Peace Corps Education Ministry brought in Peace Corps to come and help to teach. And then Ebola came and they were all pulled out. So we continue to have the ups and downs with the science teaching in the country. So we are trying to strengthen that for students to come in. We also building the teaching and studying research utilization across all our programs at the College of Health Sciences. We are establishing an experiential learning and assessment lab. When we came to school here, we learned everything directly on patients. So you can imagine if you have, at the time, our classes were small. Today, the classes are big. If you have 40 students rotating in one class, and they have to do a pelvic examination on maybe a mother, how many persons will learn to do that examination to build the skills that are required to examine the pelvis? So we are establishing a laboratory that you can learn the skills on high fidelity mannequins. They can mimic the patient, and you will learn everything that you can learn on a human being and be able to transfer that to the human beings. Now, this is important for us because for the nursing and midwifery training, normally they will ask for mannequins. It's a requirement to pass the accreditation standards. So you will go to the schools and you will see all these mannequins, but they are not being used. People don't use them to teach, and people don't use them, students don't use them to practice. They are there for accreditation purpose. So we'll open this lab to train other institutions how to use those mannequins and open it up for in-service training for the Ministry of Health as well, and for other training institutions that might not have some of these mannequins also. We'll work with the Ministry of Health to do the certificate in evidence-based health policy training. There's an interesting story. During the Ebola outbreak, the outbreak overwhelmed us. I was the chief medical officer at the time, and I was looking for solutions. I had some of my colleagues with me. I decided to just go online, Google some of the research that had been done, and just find things that could help us. And then I realized that there was a study that was done here. We have been sending specimens to Dakar for Lassa fever. And in that specimen, they identify the antigens for Ebola. And that study report was there, but nobody knew about it. And so nobody made use of it until we were jailed. I published a paper on it. Yes, we were warned. The study was there. If we had taken advantage of that study, we wouldn't have had the situation we had during the Ebola. So we want to be able to build that capacity in country that we can do the research, we can use the evidence, to make policy decisions. Working closely with the Ministry of Health in the field. And then the health innovation and entrepreneurship. So those are the 6 programs in the Ctli. You'll hear more about them. So the vision for the College of Health Sciences is for it to be a home, a set of internationally accredited training programs. And I'm underlining the international accredited. Because the programs here will fight to accredit them internationally. Some of the accreditation, the country is also building a Commission on Higher Education for accreditation. So they are a little bit behind with our health training things, and we want to move forward with it. The university wants to be among the first 20 in the region, and so the College of Health Sciences will help to put them there. So that we can produce the fit for purpose workforce that Liberia needs. Thank you.
We have heard a whole lot about the contribution from USAID to our health sector, to our educational sector, and through transformation investment by Bridgeview Liberia. As Dr. Dan was speaking, I remember that she said only a sizable and sustained investment will put Liberia on track. And that can only be done when we have this investment being sustained. So we are grateful to the USAID through the Bridgeview Liberia and the Ctli. We say thanks to you. Next will be a video introduction to Ctli program, and that will be the part 1 of the program. So we said that was the video there, and there were people in the video that we can still see them in this hall. And one of them is here, and that is Dr. Kume. We say thank you for being part of the video and contributing to the educational system in our health. So we'll now move on to the spotlight presentation. And the first person on our list for the spotlight presentation is Dr. Jonathan Taylor, the VP for Graduate School, University of Liberia. That will be followed by Dr. Julius Gelayanin, Deputy Director General Enfield, and then followed by Dr. Nuta Ballon, Clinical AM Dr. T. John F. Kennedy Medical Center. I think as we heard Dr. Dan talking about our locally made food that has to do with Benensi, Boni, and everything. I remember one day while sitting in the yard, there was a guy passing by with his trousers way down, and my dad was, those are the children who take in the cow milk. So they got cow brains. So when they take in the cow milk, that's how they suck on with their pants moving down. But now that we have somebody bringing a different dimension into our nutritional health program, we appreciate it and we are grateful to them. Maybe I want to be so fast, but I'm very moved by that innovation. And that person, if I want to recognize, there is no one else but Dr. Ballon. And we hope that that research will reach far and then we can move on to our traditional meal. Because just by using the added water to the milk, it kills the probiotic in the milk. And that alone, it reduces the nutritional status of the milk to our children. And we don't want that mentality to reach down. I think once it is affordable, and then we can move on. So for the spotlight presentation, our first presenter will be Dr. Jonathan Taylor, VP for the Graduate Study, University of Liberia. Let's please welcome him with a hand of applause.
Thank you, thank you, thank you. Let me say good morning. We recognize Dr. Saulo Nelson, the President of the University. I see the Minister of Health, the Charge d'Affaires of the U.S. Embassy, Dr. Dan, and the family of the Medical College and all of our partners. Let me first, in beginning, make self-disclosure. When I got the invitation from Dr. Dan to be a part of this program, the letter said you do a presentation, you have 5 minutes to do it. So I know, you see, in addition to be a teacher, I'm also a preacher. And they say that preachers, it's difficult when you give a preacher a mic and tell him you have 5 minutes or 3 minutes. And you know, I'm not the only preacher in this room, so some of the preachers here know what I'm talking about. But I'm really glad to be here. I want to congratulate Dr. Dan and College of Health Sciences, the entire College of Health Sciences family. I want to also congratulate the Bridgeview project and all our partners, USAID, and all those who have contributed to the successful launch of the Center for Teaching, Learning, and Innovation. I want to thank you again for the invitation extended me to be a part of this landmark program and to share briefly on the topic of teaching through research. Teaching through research. And I will ask maybe the MC after my presentation, if I'm going more than 30 minutes, please stop me. Let me say that sometimes this discussion concerning the mission of the university have focused on whether it's a teaching university or a research university. Research university meaning the mission of the university is focused primarily on research development, or as a teaching university, whether it is more focused on development of quality teaching at both the undergraduate and the graduate levels. The idea of the teaching research nexus has become of increasing importance in our thinking about higher education over the last 3 to 4 decades. In essence, this idea recognizes 2 important key functions of a university. That is teaching and research. Of course, the third one, we talk about community service and community engagement. And in fact, the argument is made that teaching and research are or should be linked in any higher education of learning. While teaching enhances the development of our students, research advances the development and discovery of knowledge. There is, in my view, the existence of a fruitful nexus between teaching and research at the higher education level. And I dare say that you cannot be a good teacher unless you are a good researcher. Teaching and research are mutually supportive. And experience has shown that constant flow of new research has served to enforce high intellectual standards, to recognize originality, and to ensure the circulation of ideals to students and through them to the larger community. In the case of the Ctli, we are told that its programming envisages connecting faculty, students, policymakers, clinicians, and entrepreneurs to optimize research-driven practices in the health sector. And I believe this is indeed laudable. In fact, the examples of the College of Health Sciences research incorporation into teaching already exists. We heard in Dr. Down's presentation that through the faculty development program, whereby recently 60 faculty were trained in evidence-based faculty development using best practices and documented instructional methodology to enhance faculty competency and strengthen the learning environment for undergraduate, graduate, and medical students as well. And I'm told that all 26 competency domains from the training showed improvement by 70% among the participants from pre-post evaluation. Secondly, under the curriculum review, that particular exercise was ignited from multiple needs assessments, literature review of medical school competency frameworks in sub-Saharan Africa, and various stakeholders summits that were held. This effort resulted in a 7-year competency-based integrated medical school curriculum, the first of its kind in Liberia that was launched in March of this year. Infusing teaching with the values of research may be the most important dimension of the teaching research nexus. It can be argued that the quality which makes higher education higher and quite different from ordinary training is that it is grounded in a deep understanding of the provisional nature of knowledge. This encompasses not just an awareness that knowledge is always changing and growing, but that it is also constantly challenged and revised. I come from a social science background, and I know when we talk about the changing nature of knowledge and discovery, that's where the whole idea of a paradigm shift. We speak about changes, things that were valid 2 years ago that are valid today become questionable as we go along in the future. Well, needless to say that you in the biomedical sciences are also constantly undergoing changes and new discoveries in diagnosis and treatment protocols for various emerging diseases, whether it's from the AIDS to the Ebola to the coronavirus. These are all new diagnoses and new treatment protocols are being developed from time to time. And all of these are informed by various levels of research. From this understanding flows the value that should characterize any teaching activity at this level. For after all, research is also a form of learning. And some of these values include an openness to the new, the unlikely, and the unpredictable. It includes objectivity, which may never be fully attainable, but is a goal to aspire to. Respect for evidence, no matter how messy or how inconvenient it may be. Respect for the views of others and civility in disagreement based on awareness that knowledge advances through debate. There's also the willingness to admit error and or uncertainty. Furthermore, the analytical rigor, which may not allow for easy solution, is a value of this framework. And finally, the humility, that is the awareness that one may be wrong, as many others have been before you. You must be willing to accept that. As we move forward, nurturing a strong research-based support for our teaching and learning processes here at the University of Liberia, let us not forget to take cognizance of the importance of local context in all of these efforts. Again, I want to congratulate Dr. Dan and the College of Health Science family for this flagship program, and I wish you well in the 3 days of the activities at the ELAB and other facilities that will be participating for the next 72 hours. Congratulations again. And Madam MC, I don't know, you can tell me how well I did with the time.
Thank you so much. You was on time, very accurate. So the next person, just before Dr. Julius Galayene comes up, we will want to recognize the presence of the Minister of Health. Dr. Jada, we say welcome, and also the Country Director for CDC, Center for Disease Control. We say welcome. So we'll now call on Dr. Julius Galayene. As he comes up, please put your hands together for him.
Okay, thank you. Let me say thanks to Dr. Dan and the Bridgeview team for extending an invitation to me to share my perspective on lesson learned from research utilization in Liberia. But before I go into my presentation for today, let me also use this medium to applaud Dr. Dan and the University of Liberia College of Health Sciences team for the level of transformation and innovation that we are seeing at the College of Health Sciences, and for the leadership and vision to move the College of Health Sciences forward. With the level of progress that we are seeing within a short period of time, we can say that the results are palpable, and we are very optimistic that within a not too distant future, the University of Liberia College of Health Sciences will achieve the objective of helping to support the University of Liberia to be within or amongst the first 20 universities within the sub-region. Thank you, Dr. Dan, for the leadership. So my presentation today is about lessons learned from research utilization in Liberia, drawing on the experience from the Ebola virus disease epidemic in 2014, looking at where we've come from, where we are at the moment, and where ideally we hope to see research, especially locally driven research, done in Liberia. We know that global health challenges and the needs of the population, they are enormous. They are complex. They continue to evolve over time. And in recent times, for example, we've seen disease outbreaks and other public health threats have continued to evolve or occur in different geographical locations at different scales and intensity. And for the case of COVID-19, have impacted the way we live, to act, and have had devastating impact on health systems around the world. And to address the complex health system challenges and health services impact from disease outbreaks and other public health threats, it is very essential, and the research and experience have shown that locally driven research in low and middle income countries is critical to provide what we term as real world, context sensitive evidence and information to inform policies, to help policymakers to make the right decisions to impact the health outcomes of the population. With respect to that, we've seen steady progress being made in most low and middle income countries, and Liberia is no exception. But we must admit that the major barriers to research, conduct research utilization in low and middle income countries still persist. To put that, my latter statement into context, let's take a look back at lessons learned from the 2014 EVD epidemic in Liberia, Guinea, and Sierra Leone to understand or reflect on how much of the lessons learned from that epidemic has been utilized to promote locally driven research in Liberia. In 2017, I had the opportunity to conduct a mixed method study to understand how much of the evidence generated from the 2014 EVD epidemic was utilized to inform policies for treatment on Ebola virus disease. And as part of that study, I did a quantitative aspect that looked at upgrading the strength of the evidence that was available to inform policies. But in addition to that, had the opportunity to interact with policymakers in Liberia and Sierra Leone. Guinea, unfortunately, because of the language barrier, I couldn't travel to Guinea, to understand their perspective on the treatment guideline development process and how much evidence was generated locally to inform treatment guidelines for Ebola virus disease following the Ebola virus disease epidemic. Unfortunately, I must say that an epidemic that generated over 10,000 cases, and that is more than 20 times the previous number of cases generated from all other previous EVD epidemics combined, we were unable or the opportunity to evaluate potential interventions for managing Ebola virus disease was missed. And because this opportunity was missed, it led basically to general lack of research evidence base to guide the development of treatment guidelines and policies. And where the treatment guidelines, where evidence to inform the development of treatment guidelines were not available, there were reliance on national and international guidelines and consensus building processes based on clinical experience to develop guidelines for Ebola virus disease management. And we know that when the local context is not taken into consideration to develop policies that impact people within a particular locality, there is a potential implication for some of these things. So as part of my interaction, we did realize that clinicians within both Liberia and Sierra Leone were still hesitant to accept and adhere to the current guidelines that was produced by international actors for Ebola virus disease management. And this is basically because everyone had their own colored convictions and as to how much what they were doing in their ETU and their clinical experience helped to improve our patient care. I do recall in particular, one respondent said that they tried a particular therapeutic for other reasons. I won't state the name of the drug, which perhaps they thought was responsible for the improved survival of patients at the ETU that he met. Unfortunately, because the research agenda from foreign researchers or research interests was different from what most of the local researchers or clinicians treating Ebola at the ETU were concerned with, some of these anecdotal experiences, the opportunity to develop actual research protocols to test the efficacy of some of these interventions were missed. In particular, this clinician did inform me that they felt a bit disappointed that more focus were placed on testing the fantastic cocktail medications or vaccines that were produced in developed countries, as opposed to looking at some of the simple supportive care interventions that they were giving patients at the ETU, which perhaps they thought were responsible for the increased survivals of patients at a particular ETU. So from this experience, in summary, we realized that research interests and agenda were foreign driven. They were controlled by foreign support. And at that time in Liberia, there was poor local research capacity and infrastructure. Next slide. How are we applying what the lessons that we learned from the EVD epidemic? Post-EVD, I must admit that significant investments have been made in improving research infrastructure and capacity in Liberia. For example, we have the Partnership for Research on Ebola Vaccine in Liberia, which is a joint US government and Liberia government initiative to promote locally driven research within the country. With the existence of Prevail within the past 5 to 7 years in Liberia, we've seen a lot of locally conducted, and the choice of words is careful. Locally conducted research as opposed to locally driven research, because there are individuals who perhaps will argue also that some of these research have little or no involvement of local researchers, when in fact the essence of having these partnerships is to ensure that the local capacity are built so that over time, researchers within Liberia and other low and middle income countries can independently conceptualize their own research, plan their own studies, implement it, and generate evidence to inform policies in Liberia. We've also seen that the National Public Health Institute, established in 2017, has a big public health and biomedical research division that conducts research, mostly biomedical research, across different public health conditions or areas of interest. We've seen also within the past 2 to 3 years the establishment of the University of Liberia College of Health Sciences, and the fantastic results that have been presented here by Dr. Da, and the level of innovation and research collaboration and partnership to improve research capacity in Liberia. These institutions are thriving, but in order to get us ideally to where we want to be, I will encourage us as local institutions or government entities to collaborate and integrate as much as possible so that we all can harness the synergies and bring together our comparative advantages and strengths to mount a more robust way of thinking or looking at public health problems and developing research questions to answer these problems to improve the population health outcomes in Liberia. With some of these programs made within Liberia with improving research capacity, we know that a lot still has to be done. And one key question that I would like to ask us is, are we producers and users of research in Liberia? Or are we just consumers of research in Liberia? As we ponder on answering this question, there are additional few questions that I would like to ask the audience to help us to reflect more deeply on how we can improve research capacity and research utilization in Liberia. First thing is research being conducted are driven by our national research agenda. There is a national research agenda developed by the Ministry of Health and the National Public Health Institute that clearly outlines the research areas and priorities, both for infectious diseases, non-communicable diseases, and other public health threats within the country. Asking this question to help us to explore further on the relevance, money, utilization, and policy impact of some of these research that are being conducted in country as opposed to scientific adventures or the desire to publish in high impact journals. Second, to what extent are local researchers capacitated or involved with research conceptualization to implementation? Next, how well did we apply the lessons from EVD to improve research for COVID-19? How much research has been done with COVID-19, bearing in mind the experience of the Ebola virus disease? And lastly, how much national investments have been made in research? Most of the research being conducted in Liberia are conducted by foreign control support. And as a result, sometimes the interests of researchers from outside of the country may or may be or may not be in line with what our local priorities and needs are. Next slide. Go back, please. Next one. All right. So as we continue to build the blocks for using research for healthy Liberia, we do acknowledge that we have made significant progress in improving research culture and capacity in Liberia, even though there are still some inherent challenges, but we strongly believe that these challenges are not insurmountable. With the level of local expertise that we have within country, there is an opportunity for us to collaborate as much as possible, brainstorm, bounce our ideas together and see how we can stimulate or nurture the culture of research and contribute more meaningfully to health policies and development within the country. As I conclude this brief presentation, let me leave you with a few recommendations. And I know there is always potential to expand on these recommendations as we look forward to improving the culture of research utilization in Liberia. As mentioned throughout this presentation, we need to continue to build more local research capacity. And the focus should not only be on core science researchers. We should focus on building the capacity of a multidisciplinary team, or team of epidemiologists, clinicians, biostatisticians, people skilled in conduct of both qualitative and quantitative research, etc. And within country, we should integrate our in-country research activities as much as possible to support the national research agenda. And the third recommendation is perhaps the primary reason for which we are here today, is to bridge the gap. To bridge the gap between science and policy by involving policymakers throughout the research cycle, from the stage of conceptualization to planning, to implementation, to dissemination of findings, and utilization of evidence to impact policy. I'm not surprised with the mixture of people within the room, because Dr. Dan, also being one of the major policy makers in Liberia for a very long period of time within the Ministry of Health, has been able to, along with the team planning this event, to bring together policymakers from different backgrounds, including the Honorable Minister of Health, to understand the essence and importance of linking research to evidence to improve health outcome. And then lastly, to encourage us as science researchers to advocate more with national stakeholders to prioritize investment in science research for sustainability and reduce dependency on foreign support. With that being said, let me once more say thank you for extending this invitation, and congratulate Dr. Da and the University of Liberia College of Health Sciences team for the innovation and level of progress we're seeing being made at the University of Liberia. Thank you.
We say thanks to the Deputy Director General for NPhil. The next person we'll be having for spotlight presentation is Dr. Nontia Ballon, Clinical Coordinator, AM WLT, and staff of the John F. Kennedy Memorial Clinic or Health Center. So now welcome to the podium, Dr. Ballon. Please put your hands together as she comes forward.
Good morning. Today again, among many spotlighters, I'm happy to be here, and I'm honored to be part of this gathering. Again, research. What impact has it made on our health sector? For our topic today, malnutrition. Knowing how much research has made to help the children of Liberia. Malnutrition globally It's a national issue, it's a global issue, more prevalent in sub-Saharan Africa, of which Liberia is a part. For our global international report, as of 2021, highlights the trend of malnutrition from 2000 to be 36%, and now in 2021, as of that time, 39%. Taking note of the trend and the increment, Liberia on the overall, from 2000 of 45% on our nutrition, now we are at 33%. We still have a lot to do and still more to do. Next slide. For the newest approach when it comes to global management of malnutrition, is highlighted the community-based management of acute malnutrition. We have a more common in sub-Saharan Africa, and for this, the main focus is severe acute malnutrition management on an outpatient basis. Liberia as a whole, the limitation of this is the fact that there's no place for managing moderate acute malnutrition when it comes to children under 5 years. The next slide. So we are going back. So in Liberia, implementing this management, the community-based management of acute malnutrition, Liberia has gone far as increasing the number of health facilities or feeding centers we have around. But again, increment in the number of health facilities for feeding centers is widely distributed nationally, but is it making impact when it comes to distributing food? No. As a clinician or pediatrician, we have most of the mothers going to the health centers or feeding centers, not getting the plumbing nurse, not getting the F75, not getting the F100. Again, we say there's a lot to still be done. At the end of the day, the limitation is the fact that most of the funds given to the feeding centers are from donors that are given to the government. At the end of the day, if the donors do not provide, government will not have funds to fund the various feeding centers. Again, we still have most of our children under age 5 years being malnourished and lagging behind. Like Dr. Dan clearly stated, if we don't have children that are nutritionally stable, at the end of the day, going up the ladder, we will have brain drain. Most of the children that will be growing up will not have been educated enough to be productive in society. From this background, we said let's, as research is far concerned, next slide. We said the goal of using locally made food to treat malnutrition in Liberia stem from the fact that it would be a sustainable method in managing and preventing malnutrition using food that are locally available in various homes, affordable and accessible to all and individuals. That's why your social economic background. Next slide. So, enrolling patients at the GFK facility, we had 300 patients enrolled from ages 9 to 36 months. Let's use our local food and see what impact it makes. So going further, we'll see the different products that were used. But to highlight, we have ages between 9 to 36 months. And we see majority of the cases highlighted there, the age range were ages 9 to 11 months, followed by 12 to 14 months. Those people in pediatrics who consider it to be very important, we have brain growth and everything. So feeding our patient appropriately or our children appropriately will be very important at this stage. Next slide. Again, looking at the sex distribution, highlighted is the fact that it was against females, and we hope to correct that. We have 55% of the children here were our females, and we need to do something about that. So for those of us that are females or women that go in the market to buy, let's take a note that we see our various homes. We see Benesi, as we term it, and we see Bonifish all on the market. Those are things that in every home it's possible you can find it and we can make maximum use of it. So we have 150 patients placed in each group. So we have 150 children placed on Benesi, blended rice, and Bonifish, and in the other group 150. So all the 150 patients that were enrolled and placed on rice, Benesi, and Boni, the study period was to be 6 months. In 3 months, or we have some of the subjects completing only maybe 1 month, 6 weeks, and so forth. So correcting that, we had among the 150 patients that were placed on rice, we have 4 of them that during the course of the study, they lost weight. So we have 146 children that gained weight over the study period. So at the end of the day, we can still make a difference, and there's still a lot that can be done with the little we have in our various homes. The next slide. So looking again, going back to the rural setting, maybe we'll find rice more common in Monrovia. When it comes to the rural setting, they have different varieties of food that we can use. At the end of the day, rice it has a seasonal variation in the rural area. So let's go back and use what's next common. We have our plantain. So we took the plantain powder, we have it blended with peanuts, and we have it blended with bonifish that we can find commonly. Again, over the study period of 3 months, we have 150 patients enrolled. And all of these patients, we had about 10 of them that lost weight during the study period. Again, we have 140 patients that gained weight, and we think it was significant, and we can promote that. So again, research by itself, from different perspectives, it affects all ages, it affects all social economic status, and we can promote more. The next slide. So again, we'll come back. What is very innovative about the research, or what drove us to do this particular research? We said depending on the F75, F100, and the plumbing laws that are scarcely available in the different feeding centers, it helps us make use of what we have locally on the market. You have some of you mothers coming and saying, I'm using the same Benesi, I'm using the same bonifish and rice for my child. Again, we say let's go further than that. Let's mix the different components using scientific measures to enable them get all their caloric intake, like the protein and the carbohydrate. Let's mix it properly and they can gain weight alone. So that was one point. Again, let's use it based on the community-based management of acute malnutrition. Let's use it as a new approach and not only depend on what is given by the donors. Sorry to the donors. But again, that only depend on what is given by the donors to treat moderate acute malnutrition and severe acute malnutrition. Using again the blended fruits, we in turn and hoping to have more research done that it shouldn't only be used for those that are moderate and severely malnourished. Let's use it as a complementary food. Madam Minister of Health, we said let's use it as a complementary food during the infancy period and during the toddler years. It's very important. We can invest more, and let's go back to the soil and promote agriculture. Acknowledgement. Having this research reaching this far, we had different sponsors, and I'm very grateful to them. The Almighty God first, the PI grant sponsors from UMass University. We're really grateful if you have representatives here. Dr. Michelle and the Boston Children's Hospital, we say hats off to you all. You did a very good job to promote this research. So the hard working team, we got one representative here, Josephine, and the rest of the team, please stand. We said during the study period, we had them working. We had a medical student that was very innovative, and 2 nurses. We say hats off to you. Again, to my family and my husband that is not around, I'm really grateful, and I really acknowledge your work. Standing here today, I will say, Papa, please stand. So we say, clinician in the hospital and not able to go red light, I will always call, Papa, can you go red light in Bama and Benesi? Can you go Westwood to Bama and Benesi? So I say I'm grateful to you for all your efforts made, and I appreciate you all. Thank you.
So we say thanks to the pediatrician, Dr. Nuta Ballon. Thank you so much. That was a good recommendation, and we are happy our honorable minister is here, and we hope that it will be as a primary supplement or complementary food for infancy. So like all other researchers and all other speakers spoke about research and teaching. Like in Africa, in our homes, normally we have our cousins and everyone that we are together. And then most often you hear somebody saying, this child is so dumb, this child is so dumb. Until one day, his uncle decided and he said, John, can you come up? He said, first day we will start. If what your teachers are saying is true, we are going to do basic mathematics skills or I'll take you through arithmetics. So he asked John, if I have a donut and I put it in your hand and I want you to know how many donuts is left. He said, so if I take the donut from you, which is just one donut, what will be left in your hands? And John replied, it will only be left with sugar and oil in my hands. So instead of saying that it will only be left with zero, he said it will only be left with sugar in my hands. And I think it can always start from the basic of our nutritional background. So that is important. We don't want to have too many joy in our community or in our family. So the nutrition status of every child is important. We'll now move into our program. So we'll now have a video introduction of the Ctl program part 2.
Profound benefits.
having. So we now move into the next discussion. That is the panel discussion, which will be coordinated by Dr. Dan, the Vice President for the College of Health Sciences, with the honor guests. Please put your hands together as you move onto the podium.
Okay, so who are our panelists? I will call on the Minister of Health, Dr. Wilhelmina Jala. Please take your seat. I will call on Dr. Rochelle Idu from CDC, Country Director. And I will also call on Dr. Christina Tabe-Slash from Yale University. So these people are joining us for this opening, and they are to help us think about the description and the important role of research utilization in public and private facilities. That one is for Dr. Jala. Public health, using research utilization in public health, is for Dr. Rachel Idu. And then research utilization in teaching and learning for Dr. Slash, who is a teacher. So maybe I can take my seat and pose my first question to Dr. Jala. How do you envision clinicians in Liberia, both in the private and public sector, utilizing research to improve patient care?
Good morning to all, and thank you, Dr. Dam, for the opportunity to be part of this panel. To our distinguished colleagues, all the honored guests here, good morning again. This is a very important topic. How do we envision the utilization of research to improve patient care? First of all, first and foremost, you need researchers. So you have to have scientific researchers as well as clinical researchers, because there are two different types of people. So if you have good researchers to do the research, then you are on your way. Then you must have the resources and the ability to conduct the research, because if you are not able to conduct the research, then both public and private will not benefit from results. Then you have to choose the topic. What are you going to be researching on that will improve the patient care? So you have to have specific things. For example, we need to conduct research on health outcomes. We need to know what are important for patients. We need to know patients across the country need to know cost. How much will it cost me to be able to get good health care? What are the available physicians or clinicians within the country? If you don't have knowledge about that, then you will see what's happening to most people. When they get sick, they go from year to different places. And finally, at the end of the day, they did not go to the right place to get the right treatment. You need to know about facilities. What are the different facilities that we have here? A lot of people don't even know that we have a dialysis unit run in JFK Yard. So if you have a patient that needs dialysis, your first thought would be to go out of the country, maybe to Freetown or maybe to Guinea. But you have it here. So you need to have research done that will give information to people to be able to take advantage of what they have within their own country. Then, of course, you need to have telehealth or other technology that will help you. Then you need to do clinical trials. We have, I think I heard about one or stage one clinical trial that will be happening here in Liberia. But we need more clinical trials. If we have stage one, two, and three, then at least we will be able to take care of our patients much better. Of course, we need to be able to analyze all of the data that we have collected. And then we need electronic medical record, because we cannot do a lot of the research that we need to improve the patient care if we cannot connect public and private information all together. You want to be able to leave Monrovia or leave any of the counties or even leave the country and have your medical records so that you can present it so that you can receive better care wherever you are. And most importantly, we need teamwork. If we are not working together as a team, public as well as private, we will not be able to solve many of the important issues in terms of patient care to be able to help our people. Again, I will stop there and I will congratulate Dr. Don and the team for this innovative work. And we hope that we will all benefit as we get older. We'll be able to benefit from research to be able to take care of chronic diseases that are unfolding, and all of the sudden death that we are seeing within the country will be able to save more lives and improve our patient care. Thank you.
Thank you, Dr. Jala. So we need to know that there are different types of research. In the health sector, we need clinical researchers. We need to know the facilities that are available. We need the technology to collect the information, do the work, and we need to be able to collect the information and disseminate. Thank you for that. So, Dr. Iduo, how does utilizing research help to strengthen public health?
Well, good morning, Dr. Don, and good morning to everyone here. I want to acknowledge the distinguished leaders of the University of Liberia. Thank you for inviting the CDC Liberia Country Director to come to this meeting. I want to acknowledge the presence of my Charge d'Affaires for the U.S. Embassy and my colleague, the Mission Director for USAID. It's my pleasure to be here. I'm going to just put my mask back on, but I wanted you to see who you were talking to or talking with. So I was thinking about the question and how the research that we talk about when we talk about public health research, how it actually starts very simply. And I think it's important, particularly as I think about those who are in training and pursuing their own careers as scientists, as clinicians, to realize that no matter what domain we're talking about, whether it's science, research science in a laboratory sense, field work, investigative work that we do, it always starts with research is answering or asking, excuse me, research is asking a question that you don't already know the answer to. And when I say that, I think sometimes in the university setting, we often think of research as something very, very involved. We think of multi-phase trials. We think of something that happens in a laboratory. We think of fairly complex protocols, and that is in fact part of what research is. But in the context that I work in every day, which is public health, specifically work that's done as part of the global health security agenda, that's CDC Liberia's mandate in Liberia is to work on global health security. We ask very simple questions. We ask questions that are going to make a difference on what we do today and tomorrow in the control of outbreaks or the prevention of outbreaks. And so I would like to emphasize that research has very, very broad applications. It doesn't always require multi-million-dollar trials. It doesn't always require 10 years. Sometimes the question can be answered very, very quickly. Thinking in our recent past about things that are issues that are important to Liberia and issues that I think 3 years ago we didn't know if we would need the answer to this question, let's think very practically. We've been blessed in the COVID pandemic by the international community and the leadership of many, many countries that they made a commitment at the beginning of the COVID pandemic that there would be no country left behind when it came to COVID vaccines. And while that can be celebrated, and while the US government Okay. While the US government's leadership in donating and making vaccines available to many countries around the world, including Liberia, should be celebrated, let's envision a situation in which the vaccines that were necessary to bring an end to the pandemic were in short supply. That is feasible. That is a conceivable prospect for a future outbreak. That the control efforts may not be able to be spread judiciously as well as universally around the world or to all those in need. A simple research question for Liberia would have been, who's most at risk for being exposed to COVID, to coronavirus? If we can identify through research by looking at risk factors, by looking at the transmission of the virus, who's most vulnerable, then you have a question, who will benefit the most from the vaccine? And the answer is in your research. That answer makes a difference for how you make public health decisions today, tomorrow, and the next day for control of the response. So in my mind, that's a very simple way in which research principles and techniques allow us to make this difficult decisions, but important decisions in our day-to-day response to outbreaks. The other thing I'll say, and this is a little bit more just my admiration for what the scientific community has achieved in the last 3 years with the coronavirus and with the vaccine. Research has a purpose of just adding to the body of knowledge. I think if we can all think back to 3 years ago when coronavirus first presented itself and we didn't know a lot about this virus, what many, many people around the world, scientists as well as clinicians, turned to was the previous body of knowledge that had already been established around coronavirus. Research that had been done 5, 10, 15 years ago that nobody knew we would need, right? Sometimes we do research simply because the question is interesting and it's important to ask, but we don't know what purpose or application it will have one day. So I'd like to encourage us as we think about the purpose of research for public health to remember that in our context, in the context of diseases that pass from person to person, diseases that can have pandemic potential, we rely on researchers to ask questions simply because they're interesting, because one day we may need that information. So thank you.
Thank you. So research doesn't have to be so complicated. You can start by asking simple questions. You can also rely on previous information to help to make decisions. So, Dr. Slash, the students are in the classroom. Why is research utilization important to them?
Thank you, Dr. Don, and thank you, everyone. It's an honor to be here and an honor to be serving with these amazing, distinguished leaders. The way that I think about students in the classroom, I guess, is kind of twofold. In the moment, you want them to be excited about what they're learning, but you are also holding the future in your hands as a teacher. And so, because research is about learning, it's about asking questions, it's about understanding what's already known and building on that, you must use research as you teach them. So you give them a published paper and you help them learn how to read it. And you help them think critically about how the work was done. Or did the researchers acknowledge their biases? Did they use the right methods? How do we know that? How was this paper evaluated? Was it evaluated by peers in the field? Can we trust what has been reported here and use it to make decisions so that when these young people in my classroom 5 years from now are taking care of patients, or 10 years from now are the deputy director of something, they can pull a paper from the research literature and read it carefully, learn from it, and use it to make decisions. And I think it also is important for us as teachers to model that. I heard recently that there are more than 1 million new research papers published every year. There is no way that anyone in any field can read everything that's out there and say, I know everything about my field. I don't care who you are. So you have to be able to be reading and learning all the time. If there's some new technique, you have to be able to find out about it. Teach yourself and show others that you are also learning. And that's all about utilizing research in teaching and in learning and modeling that for the next generation. And I think it's also important that we teach young people not to be not to be passive consumers of what's out there, but to be active learners and critical thinkers. Does this make sense? Was it done well? For example, research, our colleague talked about the importance of research coming out of Liberia and a history of research having been published from a place, not necessarily including the people from that place. That's important. We should evaluate that. Were people from Liberia part of this research? Did they inform this work based on their own lived experience? And we need to teach our students how to do that, and we need to model that as well. So that's how I think about research utilization in the classroom.
Okay, thank you. So it starts from the classroom. We'll open the floor for questions. Any questions from the floor? Okay, Dr. Duwako. And then after.
Okay, good afternoon, and thanks to the panelists. Just a small contribution. I don't know if it's going to make sense, but for research, maybe I'm wrong, but just a few years ago, Liberia actually did not have a research agenda. So I think it's about time to be able to know where you want to go with research, what is required, how you're going to use it. I think it would be very fruitful if Liberia could have one. That's one. Two, I think research should also seek to protect the study subjects in the country where it's going to be conducted. So there should be some sort of guide that would uh, guide the researchers and also prevent unintended harm. I know it's not seeking to cause any harm, but that could happen. So just to make those two contributions. Thank you. Over.
You.
Thank you very much to the panelists. My small question is, I'm confused right now. Is it that you research before you teach, or you teach before you research? Yeah. Or it's a cycle?
Okay. Thank you for the eye-opener research topic that we have just discussed. My worry is that people may go into research and there may be tons of information out there. In what way do we translate the research work to the public that they can get aware of what we have available to utilize that to improve what has been seen and been researched? Is there any way that we can move forward beyond gathering all the information and pushing it to public for utilization? That is my question, please. Thank you.
Good morning. My name is Joseph. I'm a student in the School of Public Health, and I'm from Liberia. I guess like the question of scaling up research, you first seek to sort of confront the high question of just going off after Professor Christina, who the research is actually benefiting, right? And we know there is no shortage in the literature of at least 80% of the benefit of research done in low middle income countries actually go to high income countries. That's for that. So I guess for me, being from here, I guess my question to the panelists would be, what I first, what mechanism are we putting in place for the benefits of research that are done in Liberia actually benefit Liberians? Or on top of that question would be, at least if we don't yet, but what I guess that from the international panel is there too, what mechanism could be put in place to ensure and facilitate that process, that whatever comes out of Liberia stays and benefit the Liberian in terms of research. Thank you.
Okay, thank you. Maybe we can have the answers for the first set of questions, and then we can go ahead. Having a research agenda, yes, Dr. Duoko. I actually had a question that I wanted to ask the panelists on how are we supposed to improve research utilization in Liberia when we have so many challenges. But I agree with you. If you have a very good research agenda, you will get support for it. People should know what you want. It should be well planned and thought through. It should be something that is benefiting the country, and then that's how you drive the research in your country. Without that, people will come and do things for you, and they carry them. How do we protect the researchers and those who are being used as subjects? We've also working on another front for that. So at the University of Liberia, currently there is an institution review board that actually is reviewing proposals before they go out. And I think more can be done to strengthen that. Now the other questions. Do you teach, Christina? Do you teach the research first or the research first before the teaching?
So Dr. Odowu said he's asking a philosophical question, which is kind of true. And I think you could almost say yes and yes to that, in the sense that, and Dr. Taylor, I believe, mentioned this, as you are doing research, you are teaching. And as you are teaching, you're learning. You're not necessarily doing research on your students, but you're learning. They are inextricably linked. And my colleague made the point, when you are doing research, you're asking a question so that you can learn. And in my training, and I know the vision and the training that's happening here, the people who are doing the teaching are respected learners and scholars themselves. And that is the pairing that is really important for what research is about and what learning and teaching are about. There is this idea, as my colleague said, that it's very complicated to do research, and also to the point of how do we make it available to the public. Many papers are written in a way that they're hard to understand. And so it feels like research is way over here and teaching and learning is way over here. And we as faculty and researchers, that's on us to fix. And that's what we need to be doing in the classroom. Here's what this paper says. Here's what this weird word means. Here's what we mean when we talk about this method. So students, what did they learn here? And those are the ways that we pair research and teaching. It's not this one comes first and then this one and you're done. They are inextricably linked.
Thank you. Dr. Jala, you are responsible for providing public health. So how do we translate research results to the public?
First of all, it depends on what kind of research that's done and what kind of information that you need to present to the public. Or on coronavirus, then you need to select what is in that research that is important for the public. You cannot give the public 0.25 and those kind. It's not important for the public. But what the public needs to get out of the research is what you should be presenting to them at any given time.
Okay, thank you. No 0.25 confidence interval for the public. Choose the platform. Okay, Dr. Iduo, you have been working with us for some time. The question is what mechanisms you see as an outsider that we need to put in place? And I can ask that question differently. What do you think are our strengths and challenges as we work to build capacity for research utilization in Liberia?
Thank you for the question. I'll answer broadly. I think that the answer is not easy. To those who pose this question, they're very useful and honest questions, and I'm grateful that you're raising that to us. Some of the challenge in making research available to those who are the beneficiaries, those who need it most directly, I think comes down sometimes to the benefit or the arc of research for a lot of the work we do is long. So we are trying to put forward benefits that may be seen by a community or seen by a country 5, 10, or 15 years down the road. And I know for the individual in a given community who participated in the research or made their family available or accepted that their child would be enrolled in some type of study or completed a survey, they're taking it a bit on faith that somehow in the publication of findings and in the change of policy, at some point my child or someone in a future generation will gain benefit. And I think that can be hard to translate. I wanted to speak a little bit to the comment raised by our colleague from WHO, Dr. Duarco, in the sense that there are forums that may seem token, meaning they are representational, but they are important for being able to say on a day-to-day basis, yes, the research community, the scientific community is holding itself accountable to the public. So having a community advocate or a representative on ethics review boards, I know that that may not seem necessarily to be the most transformational way in which our research is justified and made a concerted effort is made to ensure that it's relevant to the community, but I do think that makes a difference. I think that the annual cycle that we have with a lot of university-based communities as well as government institutions that are scientific conferences. For example, I know the National Public Health Institute is holding its annual scientific conference. I imagine that the University of Liberia has periodic symposiums where research can be put forward. While I know that might seem like scientists talking to scientists, often the publication and the press that's generated from those events allows for certain types of findings to be elevated for broader dissemination. And then I think the individual researcher needs to take it upon him or herself. If your activity has something to do with a community, find a way to get back to that community and share what you observed. And I think this is a slightly different analogy, but I've had the privilege, speaking to the time that you said you've spoken about being in Liberia, of traveling to each region of the country at least once now since I've come. And I haven't been successful 4 out of 4, but 2 out of my 4 trips, I've been invited to be a guest on one of these in Monrovia and share a little bit about what I saw. That for me is my commitment to speaking back to the community that welcomed me, to say, I was in your community, this is what I observed, here's what the CDC Liberia country director recommends that community or that district or that county considers and its way forward. So again, I don't think the answer is easy, but I'm trying to say that there's some things we do as individuals, and then there's things we have to trust that the process and the system that we set up is making available over time. Thank you.
Thank you. Unfortunately, we had only 30 minutes for this panel. Yeah, I see so many hands up. So when we get outside, we'll still be around. You can still ask the question. But before we go, I will just ask Christina one question. Why do we need research as an individual in our daily lives?
So thank you, Dr. Don. Why do we need research as an individual?
Be short.
And be short. Well, I maybe would take just, I think this is very philosophical, but I think one of the things that is important about being human is always learning and always trying to do what is best, to do what is safest, to keep yourself and your loved one and your community and your country well in all different kinds of ways. And we learn how to do that from many, many sources, including our families and our traditions and our faiths. But we also learn that from research in ways we don't necessarily even know. Like during the coronavirus pandemic, we all learned how to wash our hands very well. We learned what masks do for us to protect us. We learned the value of vaccines. We maybe didn't really understand that. And the ways that we protect vulnerable people in our communities. Research taught us that, even if we didn't really realize it. And I think that that's about keeping ourselves and each other well as humans.
Okay, thank you. I would like to thank our panelists. And maybe the take home message, we should have a research agenda as a country. We can utilize research in our daily lives. As students, you can start thinking critically by questioning research that have been done already. And of course, as a policy maker, you can use the results to make policy decisions. And as a physician, you can use it for your patient care. Thank you.
Doctors, nurses, midwives.
So we are out of time, or we are running out of time. The next will be the spoken words performance, and that will be done by our own students. The first person to be called is Angelinga S. Camara, medical student, Chem xSEL 2021 graduate. Please put your hands together as you come forward.
To learn is to know, to acquire, to earn. To learn is to see things when everything seems dark, to understand when nobody else does. Learning is the medium through which great minds are born, the likes of Einstein, Mandela, Hippocrates, and the list goes on. Learning, it is the place where the world changes right before our eyes through the inventions, discoveries, and all the knowledge that mankind has. Learning brings out the best version of you, makes you see the world in all shades, microscopically, politically, financially, and every other way. To learn is to know what is good and what is best, to know how to live and how to survive. It is the knowledge that we have, the knowledge that all of us have, the knowledge that great women have that make them raise their heads above the shadows and see the bigger picture. So let us learn today. Let us replace ignorance with knowledge. Let us replace assumptions with ideologies and research. Today, let us show the world how learning can be fun, how it's more than just the hours of sitting and weekly examinations. Let us see it as a gateway to the life we have not yet come to experience. Let us learn. Let us just not embrace the classrooms, but every wise words we can get from out there. Let us learn. Let us strive to gain knowledge. Let us dig deep into the wealth of endless wisdoms and understanding. Let us learn. And whatever we decide to do with that knowledge depends on each and every one of us here. But the full layman want to see the world become a better place for future generations to live. So let us learn. Not just for ourselves, but for the world and for people who will never know. Let us learn.
Good afternoon, ladies and gentlemen. This spoken word is titled Innovation. Every day, our lives are moved by innovation, a constant inspiration fueled by those who push the limitations. From local collaborations to global conversations, complacency is not an option because we beg to differ from the status quo. Because our innovation will move people. Our innovation can move places, change faces, redefine society on a daily basis. Achieving a homeostasis between humans and machines, but the only thing constant in its grand scheme is change. To live in this world is to learn to adapt. To adapt is to gain knowledge, to learn to act. To act is to seek to inspire, to educate. To educate is to teach with the passion to innovate. I would like to say this with the utmost conviction that this war is evolving because of innovation. Think about it for a second or moment. Think about the fact that right now you are viewing a stream and listening at ease through a laptop or mobile, whatever the case may be. And as you sit, you feel as if your throat is parched, so you go for a drink into the fridge you match. You take a sip of a drink that has been chilled completely, overlooking that this is powered by electricity. A concept brought into being in the 1800s, a concept that suits all advancement and passions. Through inspiration and education, this was achieved. So, imagine what innovation and education can conceive. Think of the fact that children and teens can connect to the world through the means of a stream. Imagine how adults feel having much convenience, working their jobs powering through online sessions. Trending formed by artificial intelligence. Digital textbooks strive at funding resilience. The use of digital analytics can be highly recommended. So this is what happens when innovation is extended.
But where will learning be without those who have perfected the skills of teaching it and the wonderful innovations that we all reap the pleasure of today?
No man can reveal to you aught but that which already lies half asleep in the dawning of your knowledge. If he is indeed wise, he bids you not enter the house of his wisdom, but rather leads you to the threshold of your mind. The astronomers may speak to you of their understanding of space, but they cannot give you their understanding. The musician may sing to you of the rhythm which is in all space, but she cannot give you the ear which arrests the rhythm, nor the voice that echoes it.
And where he or she is versed in the science of numbers, can tell of the regions of weight and measures, but cannot conduct you thither. For the vision of one person leaves not a wings to another. But these can only be endowed through teaching. Teaching. A profession and a mode to make students have more potential and learn important lessons. Lessons about life like respect, sharing, ethical values, and culture. Teaching. The process of attending to people's needs, experiences, and feelings. That which is the gate. Teaching. The process.
Teaching.
The process of attending to people's needs, experiences, and feelings. That which is the gateway that broadens the path to greater knowledge and concepts and holds the keys that empowers great men and women with the talents they possess. Teaching. Teaching birth knowledge. It is the basis of all theories and innovations. A harmony of skills that mold turning thoughts to perfection. Teaching. Thank you.
You gotta keep clapping. They did extremely well. So to the xSEL team, we say that was a great job that you guys have done. And we are proud to have our students coming up forward with the innovative message. Like they said, to live in this world, you have to adapt. To be in this room, you have to adjust to the AC. And it is real. So now we have gotten to another important part. That is the official launch of why we are here. And that is going to be done by Joel F. Milbury, Chargé Affairs of the U.S. Embassy. Ladies and gentlemen, I will ask that we all please stand as he moves on to the podium. The entire room is now yours.
So I wish to acknowledge the Minister of Health, Dr. Jella. Good to see you again. President of University of Liberia, Dr. Nelson. We have an appointment on Wednesday. I'm looking forward to that very much. Just so you all know, in the time I've been in Monrovia, I've not had the the pleasure and the honor to sit with the president of the University of Liberia and talk about history. I think the microphone is going a little bit. But
State Mission Director, you're right. We have Vice President of the University of Liberia College of Health Sciences, Dr. Bridgeview, Acting Dean of the Acute College of Medicine, Dr. Lawrence Sherman. I hope all the people I mentioned. Here notes that there are also some applicants. And again, thank you to all the team, faculty, and others who participated in this important work, as well as the U.S. government's implementing partners with whom we are administering these programs. Can everybody hear me okay? Yes. So today we celebrate what our great countries can achieve together. Such a proud moment as we stand at the intersection of several different partnerships between the United States and Liberia. First, there is the USAID-funded Partnership for Enhanced Engagement in Research, or PEER, in Liberia. This project is working to strengthen medical education both at the undergraduate and residency levels. Then, there is the Resilient and Responsive Health System Initiative, funded by the United States President's Emergency Plan for Aid and Health, and administered by the UFO Health Resources and Services. This initiative supports classroom and clinical training for physicians, nurses, midwives, and health managers. And now, the bringing research to impact for developing global engagement and utilization of Bridgeview, we've seen, also funded by USAID, is building off these initiatives to enrich faculty development and student learning across the College of Health Sciences. These projects are models of innovation and impact, demonstrating the tremendous change we achieved through partnership and collaboration. Our U.S. universities and other partners are working side by side with the University of Liberia and Ctli University, just as we at the embassy work side by side with the Ministry of Health to reimagine medical education. The launch of the Center for Teaching, Learning, and Innovation is yet another great achievement that marks our long-standing partnership. The Ctli will serve as a gateway to modern health education technology for the next generation of essential health workers, doctors, nurses, administrators, and guardians. Most importantly, the Ctli will be a source of research information for entrepreneurs who are expected to improve their business initiatives using research-based evidence. Know that the U.S. government is proud of the many ways in which our assistance improves health outcomes for the Liberian people. I want to digress to point out that Jim Wright and I, in the last 3 weeks, had the privilege of traveling to Guanajuato County, and last week to Grand Cape Mountain. And several months ago, we had the privilege of traveling to Bong and Niue counties. And in each of these visits, we stopped very intentionally, very purposely, to visit hospitals, clinics, meet with healthcare professionals and administrators at the hospitals. And I want to tell you all that these men and women deserve our respect and our admiration. For my American colleagues in the room, this is not the university hospital. This is not a clinic down the street where you get your COVID vaccine. Very different reality. And if you haven't been outside on those yet, it's even very different from on those days. So I don't know if those men and women who are working right now from Basa, Nimba, Bong, Grand Cape Mountain have a way to listen to these proceedings, or if there's a way to push the message out. But let's applaud them for a second. And because, and again, I'm not looking for, I think it's appropriate now, they spoke to you through us about their need for more resources. And that same message goes to others who have networks, charitable organizations that might want to look at Liberia and develop the existing healthcare resources to use to perhaps help you out. Just as U.S. taxpayers help out through USAID. There are real needs. Their work is our work. Let's just at least agree on that. Also, I've heard a lot about research, and again, on these trips, but also right here in Monrovia, I've had, again, the privilege to visit healthcare facilities and universities. One is not the University of Liberia yet, but it was the United Methodist University down in Ashland Street. And during a brief campus tour, I was taken to the laboratory. So I expected to see a chemistry lab, which I dutifully avoided when I was in high school. That was not my forte. I was crestfallen. I was disappointed. I was all those kinds of actions. When you walk into a laboratory, you imagine beakers, test tubes, microscopes, electron microscopes, whatever they call them these days. Again, I'm not a scientist. I didn't see much of any of those. I know that's not the University of Liberia, but I think what I'm trying to tell you is Liberia has tremendous potential. We're talking about students who will be the researchers of tomorrow. How can you research anything if your high school and college campus doesn't have adequate supplies? It's a rhetorical question designed in part to make you aware if you haven't been on these campuses, high school and college, that there is a need. Dr. Jalla will probably be the first to say, our hands are full. We're trying to meet the needs. I know you are. And with our partnership, not just the U.S. but others, we're trying to meet the needs. For those of you in U.S. universities, don't forget about Liberia. If you have excess supplies, does that make sense? These are potential partners and others. I'm just going to give another example, and I'll get back to my prepared text. About a decade ago, I served in Sudan. I went to the University of Khartoum, and I walked into the periodical section. You know what a periodical section in the library is? What's in a periodical section? Older and current academic journals, right? And guess what I found? Older academic journals. No current academic journals. The most current academic journals have to be from the United States, biochemistry, biology, plant, whatever, plant sciences. Dating to when Sudan had its Islamic revolution, and the government decided that we don't need all this Western knowledge. And so, in the library, filled floor and ceiling with periodicals, academic journals. We had nothing that was newer than 20 to 25 years ago. Here in Liberia, we were on the UL campus in Sinjin last week. The delightful campus, an agricultural focused campus that teaches, among other things, agriculture, engineering, technology, and education. You walk into the library, I get to my point, and I began opening books, textbooks on chemistry and other topics. And guess what I found? How old were they? And it's not to embarrass you, Mr. President. We know the realities of Liberia and Liberia's last 20 to 30 years. But again, to the audience that knows names like Sabre Foundation, which donates textbooks across the world, right? And arrangements can be made with shipment, but also the receipts, right? So whether we're talking about science equipment for the labs, whether we're talking about books which and academic journals, I would appeal to both of you and others in the room that today when you do research, you need a modern library. You need current academic journals. You don't need things that were written 20, 30 years ago, but may not be relevant things. My last example, I'm a diplomat. So I visited the Ministry of Foreign Affairs Foreign Service Institute right here. The documentation center, the reference library was sorely lacking. Again, Time magazine articles from the 1990s. Various United Nations journals, from when there was a UN peacekeeping force in Liberia. Those were among the more recent publications I saw. And so it's not just Liberia, it's not just UN. Many countries have not invested in research by spending some money, and it costs money to have online subscriptions or hard copy subscriptions. Who's with the US university here? And who knows how much it costs to buy a year or two worth of academic publications? It's not like $2 a copy. It's not $100 a year. It's in the thousands. But these are investments that I think need to be made where your researchers will not have access to the latest information. To be able to go online and get access to the latest information is where you want to be when we're talking about research, innovation, learning, teaching. You have to have the latest information. Any doctors in the room? Or PhD? This is a triage exercise. It's about priorities. So what's the most important? Again, Dr. Jolly, you know about priorities. Everything's a priority, but I'm here to say, because I used to work in the university library and loved it, that investment in research libraries, it doesn't have to be either or, I think it's both. Electronic database, what do they call it again? People who've done research know, right? JSTOR. What else? And they cost money, but that should be available to students, whether they're diplomats, medical students, researchers, all descriptions should have access. I better get back to my remarks, so I'm going to get where was I? So strengthening the health workforce is a priority for every country. And as we've seen during the COVID pandemic, there is no time to waste. Strong leaders, competent clinicians, and innovative entrepreneurs need research information. Sounds like the point. To prepare for it and respond to pandemics such as the COVID. You can't have academic journals from the 70s and 80s to tell you much about COVID-19. We need current literature. That's what I was literature. My father, who was a physics professor at Kent, would be backing me up right now. Day after Father's Day, or day after, 2 days after Father's Day. We need current research and literature to arm research. I am impressed, that said, with your innovative and strategic vision to establish Ctli, which serves this purpose. So bravo to you. As always, it is our privilege as the United States government to partner with you on this journey. With those 2 words of partnership and collaboration, I hope you take it as such. Again, American partnership across the sea. This message is also for you. I'm pleased to announce. Where's the ribbon? I'm pleased to announce something that I'm supposed to be doing, but I don't. But I'm pleased to announce that the Ctli is officially launched.
One house, please. So now we are had the grand opening of the Ctli. We say thanks to the USAID and thanks to Bridgeview for the transformation investment to our health system and to the College of Health Sciences. We are grateful to you all. I will also want to use the medium to recognize the Chief Medical Officer of the John F. Kennedy Medical Center, Dr. Sia Wata Kamano. She's here, and we say welcome. So we will be hearing or welcoming onto the podium not someone who is so strange to us. He's someone where when always there is wills in the wild, he knows how to calm the situation down. I remember we as students, he will always tell us to go back to channel 1. And that is when we preach the protocol or the channel for information to us as students. And he will say, they didn't reach channel 1, please go back to channel 1. He's also someone who is a preacher. I don't think he needs that timer to be set on him, because he always gets his words from the other speakers or the previous speakers that spoke. So I'm sure he has already have his words being put together already. So dear ladies and gentlemen, with our distinguished pleasure and honor, we welcome up to the podium the president of the University of Liberia. It's no one else but Dr. Julius Saulo Nelson. Please welcome him.
Thank you. Channel 1 is the Office of Student Affairs. And if you leave Channel 1 and come to the president of Channel 2, then you are sent back to Channel 1. Dr. Wilhelmina Jala, our Minister of Health in the Republic of Liberia, Dr. Edwin Wakojo, the Director General of the National Commission on Higher Education, other officials of government and agency present, our Ambassador Joel Membury, the Charity Affair for the U.S. Embassy, and we are looking forward to receiving you tomorrow on our Findale campus. Jim Wright, the USAID Director, Dr. Jonathan Taylor, our Vice President for Graduate Education and Research at the university, Honorable Dr. Bernice Dam, our Vice President for the Health Sciences, Professor Stephen Jugwe, our Associate Vice President for Academic Affairs and the Dean of the Faculty at the university, our partners, supporters, friends, the United States Agency for International Development, the administration, and colleagues of the John F. Kennedy Medical Center, other vice president present, deans, academic coordinator chairpersons, and members of the University of Liberia family, faculty, staff, students of the College of Health Sciences, our partners from various institutions, Vandenbrand and Yale, members of the Fourth Estate, distinguished ladies and gentlemen. Let me begin by saying a big thank you to the leadership of the College of Health Sciences in person of Dr. Bernice Dang and our entire team for the work and collaboration with our partners in bringing this project to fruition. Thank you so much. We are grateful from the University of Liberia and the people of Liberia to the government and people of the United States of America and the United States Agency for International Development and other partners for their faith and investment in us here in Liberia, but especially so at the College of Health Sciences of the University of Liberia. I am confident that the Center for Teaching, Learning, and Innovation and all the related programs will be very transformational for our faculty, for our students, and for the people of Liberia. I'm also excited because the center will serve as a hub for collaborative training and innovation with the larger society, including clinicians, policymakers, and entrepreneurs in the Republic of Liberia. Universities are a part of the fabric of the community, and it is our privilege and mission here at the College of Health Sciences to promote lifelong learning and research in partnership with our neighboring institutions and colleagues throughout the world. I'm also excited because the opening of this Center for Teaching, Learning, and Innovation is a momentous occasion which builds on years of progress at the College of Health Sciences that is ushering in a new era for high quality and professional health education in the Republic of Liberia. It will also interest you to note that 50 years ago, we started with just the AMWT, now School of Medicine, but today, in spite of the challenges faced over the years, we have a basic campus with 4 schools, including the School of Medicine, the School of Pharmacy, the School of Public Health, and the emerging School of Nursing and Midwifery. As well as strengthening our financial and administrative system as to do partnership with friends and other colleagues from other institutions of higher learning. As you all know, such growth comes along with its own set of challenges. Today, the freshman classes at our different College of Health Sciences is beyond the usual number in the past, where it was restricted to below 50. Now we are forced with the interest to receive classes that are beyond 50, and we must adjust, we must adapt ourselves to the teaching realities of the Republic of Liberia. With an ever increasing number of students, we are reaching the capacity of our classroom and dorms. Presently, we were forced to relocate the preclinical medical students to our Findia campus. We are envisioning the expansion of additional system that will put in place support with the anticipated growth within the College of Health Sciences. You need to know we have done all the different research and assessment by the Ministry of Public Health that we are forced now, Public Works, that the Sea View dormitory will be brought down in the shortest possible time. It cannot meet the condition to accommodate our students, and we got no other reason but to bring it down and put in a new structure to accommodate the new enrollment of our university. As the need for clinical training continues to remain critical for quality health professional training, we also realize that our own campus needs continuous strengthening. As a result, we will continue to work with our partners at the wonderful John F. Kennedy Medical Center and elsewhere to make sure that we are providing our students with well-equipped faculty and quality supervision and mentorship in the healthcare sector in the Republic. We are proud to be associated with the training of the future generations of Liberian health workforce, which include clinicians, researchers, policymakers, and even future faculty members who will keep us all safe and healthy in the Republic of Liberia. For us, as the management team of the University of Liberia, it is our duty to provide a comprehensive and enriching educational experience that will prepare these students to be the leaders and change makers of the future. But just remind them, for you to have that change, you yourself must change and find different ways to solve problems in the Republic of Liberia. We are so grateful for the support of our friends and partners the United States government, USAID, all the institutions that we are partnering with on this journey in health education for our health sector in the Republic of Liberia. Let me close by urging all of us to continue working together as we continue to develop the health workforce of our beloved country, the Republic of Liberia, and reduce the patient to health worker ratio far lower than what it is now. Thank you so much, Dr. Don and your team. Thank you so much. Our partner, thank you very much. The BRIDGE program and our continuous partnership with USAID and the people of the United States of America. God bless you, and let us all celebrate this new idea for a new hub for teaching, learning, and innovation at the College of Health Sciences, but especially so at the University of Liberia. God bless you.
That was a special statement by the president of the University of Liberia, and we say thank you for affording the audience here your words of encouragement, especially to our partners in the U.S. government. We'll now have our video.
With students. Research shouldn't just report entrepreneurship. It should drive innovation to develop new products and technologies and improve the health system for patients, practitioners, and all Liberians. Our innovation team's purpose is to connect academics and entrepreneurship. We want to foster an ecosystem where innovators apply research to develop new ideas and commercialize them.
ELAB Liberia, local non-profit tech hub in the consortium for improving medicine with innovation and technology at Mass General Hospital, are working with the Ctli to design programming for budding entrepreneurs.
We just returned from a tour of the XSEL training. There are engineering and we learn about innovation process.
from ideation to incubation and acceleration. So we are happy to bring these models to everyone. We will host events such as seminars and office hours, run an incubation program to provide long-term mentorship and facilitate access to seed funding. The Ctli also envisions connecting innovators with service providers through commission, hackathons, and design challenges. All of this programming aims to create and scale solutions that strengthen our local health system, impact patients' lives, and grow our local economy. I'm Kenny Joshua, CEO of Medical Mobile Liberia, where I started this project focuses on the work that we do and the efforts that we contribute to the healthcare delivery sector of Liberia. We believe the future of Liberia is in the hands of Liberians. And through CTRI, we look forward to supporting innovative ideas to tackle our highest challenges. We welcome students, faculty, health workers, entrepreneurs, and anyone with an innovative idea or research for improving the Liberian health sector. The CTL's goals is to teach research utilization and build research utilization competences across the College of Health Sciences. And the CTLI will promote research utilization skills among faculty and student researchers. What is meant by research utilization? So first of all, we're going to define research utilization, and that will entail that our scholars become leaders in translating research outputs into development impact. So for each competency, each defined competency, we are developing specific learning objectives and conducting a systematic literature review to understand best practices for teaching these students the skills that are needed. These learning objectives and teaching methods will be integrated into the curriculum of the 4 schools here at the College of Health Sciences. So the 4 schools at the College of Health Sciences here, we have the medical school, the school of pharmacy, the school of public health, and the school of nursing. As part of rolling them out, we will train the respective faculty in each of these schools so that they are well equipped to incorporate research utilization skills into their courses. Now, to make sure the impact of this project, we will conduct evaluations of both the process and the learning outcomes. So the objective actually of the research utilization is actually the use of research funds with purpose to improve patient care. And evidence-based practice supports decision-making in healthcare. We envision that over time, faculties and students will be well equipped to use the latest research and latest evidence to improve the quality of their own work wherever their careers take them. Whether it is as clinicians providing care for patients, as researchers studying public health emergencies, as a government official crafting health policies, or as health faculties that we were the next generation.
Actually, I want to make a video about the ice bath now to my body because I'm feeling hot. Actually, so when I have a short now, my body is
Thank you so much. Good afternoon, everybody. We've been excited and we are still excited. And tomorrow the innovation team is really excited because we want to make an announcement for our faculties. We want you to please, we want to talk with you just 2 minutes after this program. For all the faculties across the ULCHS, we want to please allow us to just see you for 2 minutes. Thank you so much.
Please. Just 2 minutes. Please give your time. So we are at the end of the program. That is the lunch and the poster section at the Ctl house. So for those of us that do not know the area, is back at the field where we have the CV dormitory. There, so we'll ask the audience that our platform guests will have to leave first, and then everyone else will follow. Once again, we say thanks for your undivided attention and your entire time to this program. So we'll ask our platform guests to please leave, and then we'll follow. Lunch and everything will be there. When I say I need an ice pack, not on my body, but into my belly. That's why I need my ice pack now. So the platform guests, our protocol people, please come up front and take the platform guests